Okay, picture this. Sarah has waited 6 long weeks for this doctor's appointment. 6 weeks where her life has just been completely turned upside down. And now she's in the exam room, staring at the clock, and she knows she has exactly 15 minutes to get her doctor to believe her, to finally get some help.
I mean, she's been dealing with hot flashes ambushing her during huge work presentations, leaving her just drenched and, totally mortified. She's had brain fog so thick that she literally forgot her best friend's name in the middle of a sentence. And sleep? Ha, that's a joke. Thanks to night sweats that have her waking up feeling completely exhausted day after day.
So yeah, this is not just any old appointment. This is it. This is her shot. She's got 15 minutes on the clock, and for Sarah, this is the countdown to hopefully, maybe, getting her life back. The pressure is just unbelievable. And as you're about to see, her story is probably way more common than you think.
Yeah, I bet it does. And if you're sitting there nodding along right now, I just want you to know you are so not alone. Sarah's story is frustratingly, ridiculously common, and it points to this massive gap in women's healthcare. Millions of us walk into that same 15-minute window feeling desperate and walk out feeling completely dismissed.
And this isn't just a feeling. We've got the numbers to prove it. Research shows that a staggering 79% of women feel that the information and support they get around menopause is, well, poor. It's not just about one bad doctor. It's a whole systematic problem, and it's leaving so many of us to just suffer in silence.
Right, so Sarah starts trying to explain everything that's been going on, but the doctor kind of cuts her off and pulls out a clipboard. And just like that, the appointment turns into this bizarre high-stakes game of what I call symptom bingo.
The doctor just starts rattling through this generic checklist. Hot flashes? Check. Night sweats? Check. And before Sarah can even get to the crippling anxiety or the fact that all her joints ache, the doctor glances at the clock. It's minute 12. Time's up. She leaves with no treatment, no plan, just, let's book you another appointment in 6 weeks. Unbelievable.
Exactly. It feels so hopeless, but I promise you it's not. So how do you completely change the game in that appointment? What if you could walk in with a tool so powerful, so clear, that it basically forces a productive, solution-focused conversation? What if you had a secret weapon? Because in this situation, preparation is your power.
Well, that tool actually exists. Think of it like your own personal doctor's decoder ring. It's called the Modified Green Scale, and it is scientifically designed to translate everything you're feeling into a language your doctor can immediately understand and, more importantly, act on.
Now, this isn't just some random checklist you find online. This is a real, clinically validated, standardized tool that's used in actual research. It takes all those feelings that are hard to describe, the anxiety, the fatigue, the brain fog, and it turns them into objective, numerical data. It gives your doctor a complete snapshot of your quality of life in a single glance.
And you can see just how thorough it is. The scale is broken down into 3 key areas: psychological, physical, and sexual symptoms. We're talking everything from anxiety and joint pain to things like vaginal dryness. It gives the full 360-degree view of what's really going on.
And here's the best part. You do this at home. You take your time, like 30 minutes with a cup of coffee, and you really truly think about each of the 21 symptoms. You just rate them on a simple 0 to 3 scale, from not at all to extremely. There's no doctor staring at you, no ticking clock, no pressure. You walk into your appointment already armed with cold, hard data.
Okay, this is where Sarah's story gets good. Let's hit rewind and go to her follow-up appointment. But this time, she walks in prepared. She walks in with her completed green scale. She basically has a superpower.
And the difference is just night and day. Instead of frantically trying to remember every single symptom while the clock is ticking, she just hands over this piece of paper. The doctor sees the scores, gets the full picture instantly. No more symptom bingo. The entire 15 minutes are now spent talking about solutions, treatment options, what to do next. Sarah leaves with an actual plan. She leaves with hope.
And Sarah's transformation, that isn't just a nice little story. It is backed by actual science. Studies show that when women use a structured assessment like this, the whole focus of the appointment shifts from just diagnosing to actually treating, and the results are pretty incredible.
I mean, just look at this data from a study that used this exact approach. With proper treatment, women saw an 85% reduction in the severity of their hot flashes, an 81% reduction in depression, a 72% drop in that crushing tiredness. These numbers aren't just stats, they're life-changing. So what did this really mean for the women in the study? It was huge. On average, they went from suffering from about 14 different symptoms down to just 8.
And the overall severity of the symptoms they still had, it dropped like a rock. This is the power of having a prepared, data-driven conversation.
So, okay, we've seen the problem, that rushed, frustrating appointment, and we've seen the solution, using a structured tool to guide the whole conversation. So now, the big question is, how do you actually put this into practice, easily and effectively?
Because being truly prepared is about more than just one questionnaire, right? You need to have everything organized, clear, and ready to go. The real power comes from having a comprehensive tool that's literally in the palm of your hand.
And that's where this comes in. Meet the Empowered Patient. It's an app that was specifically designed to help you transform from a frustrated patient into the confident, prepared leader of your own healthcare journey.
The Empowered Patient has the entire 21-point modified green scale built right in, so you can track your symptoms super easily over time. But it does so much more than that. It helps you organize your entire health history, it helps you track crucial cancer screenings, and it covers all the other health topics your doctor really needs to know about. It literally prepares you to walk in there and lead the conversation to get the care you absolutely deserve.
That 15-minute appointment doesn't have to be something you dread. With the Empowered Patient, it can be the most productive 15 minutes of your entire month. So, are you ready to stop being a passive passenger and actually start driving your own healthcare journey? If so, download the Empowered Patient and take back control.